I get asked a lot of questions with regards to our exploratory panels and why we have certain tests on there and other ones that we don't, and what is the whole vision behind that process. The exploratory panels are really about creating a baseline for your health and knowing where you stand, because so many of the things that are going wrong inside the body don't necessarily have symptoms until well into the disease process, where we're trying to catch things early and address the root cause. The exploratory panels are designed around finding the root cause, not necessarily a diagnostic code. Two very different things, and I know this is something new for a lot of you. So in modern medicine and what we've been trained to do, we've been trained to find like this ICD-10 or whatever number we're at right now with the book. It keeps going up. I've been at this for a really long time. They're trying to find a code, that this code therefore gets submitted to your insurance company, and then that dictates the kind of treatment that you're going to get based on this particular code. Well, I understand that's how modern medicine works. I don't care. What you care about, what I care about, is what's the root cause. I don't care what code we have to put to it. I care what's really going on and what will make you feel better and what's going to actually reverse this process so that you can live healthy, wealthy, fulfilled, and happy and whole. So when we look at it from that perspective and just change that paradigm, well, it changes which tests you run dramatically. Because while there's some really cool tests that can give us some really interesting diagnostic codes that I can fill into boxes, it doesn't tell me anything. It doesn't tell me how to help you. It's just a name that now I can label you with, and now that label follows you. It just doesn't, in practicality, it doesn't make sense. What does make sense is economizing down to the most important areas of the blood that can tell us which systems are working, which systems are not, where there's a deficiency, and what that deficiency is, so that we can therefore then address it. And when we do it that way, you get better. You don't just get a report, everything's normal, and you still feel horrible. You actually are going to get results. And furthermore, I don't use certain tests because there's sometimes one test that's very, very expensive and would really increase your out-of-pocket costs, when there's another one that gives me the same amount of information for a fraction of the cost. I'm going with that one. Because here's the thing is, we can always go and we can always add expensive tests later if you're still not getting better. But we have this narrowed down to the point where 80-90% of people don't need anything else. We are able to find everything that they need with just this base, because it's designed to reach the masses. Are there times that individuals have like different issues and different conditions that we want to go and get a little bit more information to get to a deeper understanding of what's going on? Absolutely, and yes, yes, that's viable. But for the most part, see, it doesn't matter if we run this rare exotic parasite test over here. Here's the thing is, even if that does exist, if you don't have a basic immune system, it doesn't matter, because the immune system is what's going to take care of the parasite in the long run. So let's get you healthy on this foundational level and see if there's just anything even left. It's Occam's razor. Keep it simple. And the simplest answer is usually the right one. And getting complex with it, I have found, just confuses a lot of people and just ends up taking people in the wrong directions. So why do we run the exploratory panels the way we do? Because it works. Because these are the tests that give us the most information, that get the biggest percentage of people so much better, feeling better, living better, and we're able to do it at a fraction of the cost that so many other people are charging. And I would much rather put your resources towards your resolution I would much rather you have, or I don't want to spend all this money on all the tests. I want the money spent on the healing and the health that you're going to get at the end of it. And that's what's important, and that's what really matters, and that's why we designed it the way we have designed it.